Hey guys, welcome back to another dose show. This time we're doing it at home, as you can see. And we're going to interview Dr. Amanda Gilbert, who is a primary care physician in Texas, to learn a little bit more about this COVID-19 virus and how, since my last video about it, how has it changed and what are we doing right now and seeing in the hospitals right now with patient care. Stay tuned. I did it on an IG Live, so I'll put the recording there. And please leave any comments, any suggestions, any questions, and also make sure you smash that like button and make sure you're subscribed and make sure that you're following the dose for weekly episodes like this one. Okay, thank you guys, and I hope you're out there staying safe, washing your hands, and just social distancing. Okay, have a good one.
How are you?
Good. How are you, Dr. Amanda?
I'm good.
And where are you?
So I'm in Pearland, Texas, which is right outside of Houston, so southeast part.
Nice, nice. Texas in the building.
Yes.
So, okay, so we know a little bit about you, but can you tell us more in your journey to get to this point in your medical career?
Sure, definitely. So I'm originally from Chicago, Illinois, born and raised outside. And then I went ahead and went to Howard University for undergrad, where I majored in biology, minored in chemistry. Found myself back in the Midwest for the University of Illinois, where I went to medical school. I came to Baylor back here in Houston for residency for family medicine, where I met my now husband. And we are making Houston home, so.
That's okay, because I'm in DC right now, so that's amazing.
Yeah,
so you've been all over. I thought I was, all over the place. I went from DC to New York to California. So that's amazing.
Yeah.
And so, okay, so what's the scene? We see the media. We don't know what to believe. How are the hospitals? Is it really chaotic, or is it under control?
Right. So my clinic, we're in partnership with one of our larger hospitals. And so being on the front line as primary care, we're trying to help to mitigate those issues there in the hospital. So thus far, we are trying to keep our ER doctors as calm and peaceful as possible, but that's difficult to do. Because a lot of people, they're having these symptoms, they're reading what it says, and their first thing is, well, I need to go to the ER to get tested. Not realizing, based on current CDC guidelines, that there is very strict qualifications to even receive a test, okay? Yeah. So that's my job as primary care, helping patients to triage now to decide, yes, you may have the fever, the dry cough, but if you're not having significant short of breath, we can manage this at home, because at this point it's supportive care. Despite what's being said that there is no medication that is now available to go ahead and treat if you have these symptoms. So
I was going to ask that. I was definitely going to ask that. So are they calling in, or are they coming in?
So about, I would say, end of January, February, our clinic was still running per usual. You can walk in, we would get you in. I had same day appointments. Now we're trying to stop that, because we don't have the actual N95 masks, because we are sending those to our hospital. So I've had patients this week that have came in with high suspicion of possible COVID infection, and we had to tell them, go to your car, I'm going to call you, because we don't want them to come in and infect other healthy patients. Right. So right now, at this point, today's been the first day where we are totally virtual, with the exception of some of our pediatric patients. We're allowing them to come in, but only like with one parent to supervise them, and the parent has to be well, no sickness or anything like that. But right now we're all virtual, either telephone calls or similar to this situation where we're on video.
Yeah, so you do telehealth too. So you do some video conference calls. That's awesome. And so how many cases are there in Texas? around the
Yeah, so the
100?
numbers are actually rising. As of earlier this week, we were somewhere around like 5 to 600, but
Okay.
that was before we actually had the drive-through testing centers. So a lot
Okay.
of the places, like when we're looking like in New Orleans, Louisiana, who just had like a spike in their numbers,
Yes.
we might have
Yes.
seen like the pictures where we're showing the curves growing. A lot of them had the testing sites already available, so they were actually just testing more people. That doesn't mean that we don't have cases here. We're just trying to get a little lag of actually getting them recorded that they actually do have the cases.
Yeah, that's what I was saying. It's like we have the number out there and we see it on the news just growing, but we really don't know how accurate it is. It could be more,
Mm-hmm,
you know? So
mm-hmm.
that's really interesting. So you mentioned the PPE and not having a shortage in the hospital. So do you have enough for your staff and yourself?
Yeah, so for right now, we're using like our basic protective garments. So gloves, we have our little surgical mask here, but which things I've never done before. Usually I would have one of these and I can switch it out with each patient. I'll see a new patient. I have to use the same one every day.
Wow.
So right now I have like 7 available. So that should get me at least until next week. But yeah, this is a different type of world that we're living
Yeah.
in that like none of us have ever experienced before.
Yeah. And have you ever had like a scare where like, you're unprotected and you encounter a patient, you're like, oh my gosh, wow.
Yeah, there's been several scares, like, and now even thinking about a couple of my colleagues, we were thinking around like February. We know it's flu season, but this was before we had a lot of cases within the states. Um, we did see some patients that would come in, very typical flu-like symptoms. When we would swab them, it would be negative for the flu. But we went
Yeah.
ahead and empirically treat for probably it's influenza, it's February. If it sounds like a duck, walks like a duck, maybe it's
Yep.
a now we're thinking that it probably was corona
Okay.
because we didn't
Okay.
have the testing. We didn't think highly of it. We were not asking questions like, oh, about travel and things like that.
Yeah.
So likelihood of me being exposed already is high. So at this point.
Yeah, but you never felt ill yourself.
No, no, no. Knock
Okay.
on wood. Thank God
Okay.
that no, I've never felt ill, no symptoms or anything like that. So that's good.
That's awesome. So, okay, so is it a major difference between these patients? Are they just hacking dry cough? Can you kind of tell now at this point the flu versus the
So that's the
coronavirus?
scary thing is really not much difference that we're seeing.
Mm,
So, and especially too, it presents differently. Like, so we've been seeing cases of like some of those NBA players that they're like, I have no symptoms. Idris Elba,
yeah,
I have no symptoms and I feel fine. Like, I don't know. So it goes to that range to people actually having like, no, I'm having this hacking cough. I'm
right.
having fever. I just don't feel well. I don't know. This just kind of came down all of a sudden. Versus even now, even we're adding that some people are having like GI symptoms of like nausea, vomiting,
Yeah,
diarrhea. So these are different things that we're seeing, and
yeah,
it's really sometimes hard to pinpoint. And the biggest thing is that, well, to the point where if I'm on the phone with a patient, looking at them through a video, and I'm wondering if they're unstable, then well, no, we need to get you to the ER so that at least they can test you to decide if this is corona, if this is the flu, or is it just like bacterial pneumonia. We just need to go
right,
ahead and triage to decide who's appropriate to make it to the ER.
right. And man, and it's just that, the ventilator issues and different things like that. Have you heard about that? The
Yeah.
shortages? Yeah.
So, it's one thing that has been really cool, and I have to shout out RD that was really allowed us, Mr. Doctor, to stay connected with
Yeah.
what's going across the country and the world. A lot of our colleagues in like New York, they are really concerned that they're going to run out of ventilators. At this point, like I said, our cases have not been as high as other places in the country. But there's a great concern that, we're going to run out and that now using some of our privatized industries
Yeah.
where they have the capabilities of making other machines. Oh, but now you need to make ventilators because we need to make sure that we can keep people safe. Texas has done the job of, and our governor now has released the mandate for Texas Medical Association that all elective procedures, so surgical
Yeah.
procedures,
Hmm.
if it can wait,
Yeah.
we're gonna make it wait because if that's a bed, that's a ventilator, those are anesthesiologists that
Yeah.
if needed, we need to go ahead and recruit them in.
Yeah. Prioritizing is
Yeah.
definitely key. Would you say that everyone was prepared for this, or did it just kind of?
Definitely not. Like so funny story. Back in January, there was a case that came into my clinic.
Uh-huh.
An individual who said, "Yeah, I was hospitalized with coronavirus." They didn't have any paperwork from which hospital because it was nowhere in Houston that they were hospitalized. And so initially we were like, well, that's an off chance. Of course, there's different strains of the coronavirus. So it wasn't the COVID that we needed to be concerned about. But that was just one of those things in January where as a hospital system, a clinic system, we were just like, oh, okay, well, we're going to keep in mind that this is
Of course.
And then all of a sudden, like every day, it's a different trajectory, what we're using, how we're screening, who can't come in.
Yep.
It's very much interesting.
So. Yeah, and I think that's what the public needs to understand is that, yes, we're doctors, but it's changing. And there's different recommendation, and we do go by guidelines. We don't go by just anything, so it's something that's hard. And it kind of feels like we are, like, I want to say to you, thank you for your service. Like, it's almost as if you're battling this, and hopefully we can all find an answer together. I was going to say, can you debunk that whole myth of only elderly can get it? Is it?
Yes. So the whole point with that, the CDC, their new recommendations as they're updating, that's where you can get up-to-date information. CDC, not YouTube, not Facebook, but CDC. They were just saying that the highest risk population, 60 plus. Why? Because usually at that point we have some type of comorbidities, other diseases that weaken our immune system, like type 2 diabetes, any heart issues, lung issues. However, in Houston, as now like I said, we're getting these more cases. The majority of our cases are largely 40 to 60.
Wow.
Now, I'm not saying that these people are needing to be hospitalized, but we're definitely seeing that this age group that would initially be like, well, these are not the ones we need to be too worried about. You'll just bounce back. We're seeing that we're having more cases with them. I think it's going to be really interesting after this is all said and done, looking at the public health, when we're looking at the stats of how this all played out with community spread.
Yes. And so what are you doing personally to cope with this,
So, it's been really important for me to make sure that I'm still setting the same intentions that I do every day and every morning to make sure that I'm present for my patients, that I'm going to be productive, and that in each time I'm listening. Because now that we're switching to these virtual visits, I don't have the luxury of having my patient right in front of me. So I have to make sure that my eyes and my ears are on tune and I'm not missing anything, Two, recognizing that although this feels like a two-front war, we're fighting COVID, not forgetting my patients who are healthy, they're not
that's a
sick
big
with COVID.
challenge.
But how can I make sure that we're keeping them well in this? So, things like mental health. I've had a few patients that were going through, we had their anxiety under control. COVID now is throwing that all out the window. Yeah. So, making sure too, like when I get home, with my husband, with my family, we just take that time just to say, okay, let's just break. We're going to turn off the news. Yeah. So it's been important for me practicing my yoga. My gym is closed. I usually go into the gym in the morning before work. So I'm using like my Peloton app, getting on there in the morning just to kind of woosah and taking a walk. Oh, we still can. Just taking a walk outside, saying hi to my neighbors from a 6-foot
from afar.
So doing all those things is just helping me to stay grounded.
Awesome. That's really good. It's good that you're healthy so that you can make sure everyone else is as well.
Yeah.
That's so cool. So what do you see as a future after COVID? Like, how are we going to get back to normal life? Is it possible?
I think the biggest thing is understanding how we'll have our perspective. So if we as a world, we as a country look at this as, this is a new world order, everything is different, we can't even worship together, the same churches or spaces, I can't see my doctor. Instead of looking at it that negative perspective, let's shift it. We have the opportunity to see a mass cultural change.
Yeah.
So in terms of medicine, it's exciting now that we're having these multiple ways that I can reach patients. We know right now in the country that we do have a shortage of primary care, of family medicine doctors. So now everyone, most people, we have a phone. Most people have access to an internet. So at least that's one way I can reach maybe somebody that lives maybe 30 miles out that doesn't have a doctor in their community. We might not have had that reality or that push if it wasn't for this time where we needed to do that. So things like that, or thinking that, in other ways that we can, my thing is being intentionally intergenerational, not getting focused on, oh no, I can't see my 60-plus-year-old family. I can't have any in contact with them. This is a good time. Let me just call them.
Yeah.
Let me talk with them. Let me make sure, like, how can I connect with them? Can I show them how to use FaceTime so that way we can see each other?
Yes.
So all those things is about shifting our perspective and knowing that this will not be forever. This is a period. Not sure when it's going to end. Forever. So we have to stay hopeful with that.
Exactly. Well, that's a good perspective, especially you. Like I said, it's on the front line and you're still this positive. That gives us hope for those at home that they can stay positive as well. Mm-hmm. And so what I decided to do is ask, see if they have any questions in the comments, and I'll probably ask about 3 of them.
Okay.
Let's just check and see if they have any. Do you have any more patients today?
Yeah, so I do. I have a couple of virtual visits this afternoon. An ER follow-up coming in. So
nice.
It's still moving. We're still moving over here. So
of course. Yeah. Okay, so this is just a comment. They said, I just have to say I love to see Black women in the healthcare field. It brings so much joy to my heart.
Yes.
That's so special.
Yeah, thank you for creating this platform, Robin. This is amazing too. I'm now a fan, girl, so I'll be tuning in every week too.
Yes, I'm following you too, girl. Let's see if there's any questions. Let me just ask now. If you guys have any questions, did we touch everything? Okay. Plaquenil and celebrity testing. I'm not sure is that 2 different questions? I guess, what do you think about Plaquenil?
Yeah, so Plaquenil, so what is that medication? So it's an old drug that has been used for a couple of things. One has definitely been used for malaria treatment. So we've been seeing it where it's effective in that. And then also for different anti-immune-like symptoms.
Like rheumatoid,
rheumatoid arthritis, things of that nature. Plaquenil has been helpful with that. Plaquenil, hydrochloroquine, if you've heard those names, chloroquine, all the same. There have been some cases where people have noticed that hospitalized patients, when given this medication, they've had some improvement in the symptoms. Now, hopeful, sounds really great. However, even if I'm one of the most optimistic people probably in the world, I still have to be rooted in science.
Yes.
And so there's still so many more testing. And that's what a lot of the CDC, the head CDC doctor was saying, that we're not sure exactly if this was just like by happenstance that we saw this. So what can we do with that? And including like azithromycin, the normal Z-Pak, that there has been studies that showed if you combine them with the Plaquenil, maybe there could be some improvement. Right now, it's not enough studies. It's not enough tests to say this. Please do not call your primary care doctor asking to stockpile on your Plaquenil and azithromycin, because that's going to be a no. So
yeah.
The biggest thing right now in terms of treatment of COVID, if it's not to the point where we need to be hospitalized, is going to be symptomatic treatment. So what can we do for that cough?
Yeah.
Albuterol inhaler if you are having some shortness of breath, just to kind of give you some relief from there. Tylenol, ibuprofen is needed, lots of rest. That's basically going to be your mainstay of treatment for right now that we know.
Yeah, and all of them saying that, ibuprofen is interacting with the virus. But it's just, we need that. As, as healthcare professionals, we actually need the studies. We need the evidence and the data on that. So I agree with you that there's promise for those drugs, but we have to see that.
Yeah, and they're not Skittles. So every medication has some type of side effect. And so if we're just
Yes.
throwing this at you and we don't know how you're going to respond, there's lab work that usually needs to be followed once after you start Plaquenil. How do we just stop you off of Plaquenil? So there's still so many questions that need to be answered.
Yes. And someone, let's see, another one. So someone said, is there anything you're consuming daily in an attempt to avoid the virus?
Yeah. So, honestly, this is what I do every day because
Okay.
at this point, I feel like I've come across a whole lot of different viruses and bacteria, working in the med center from residency, all that. So I'm always taking my multivitamin.
Yep.
Now that I'm out of residency, I can get a consistent 6 to 8 hours of sleep most nights.
Very important.
So, and then to exercise, that's so important that does what that does for your immune system. I'm a little behind today because we were busy, but I have my water here.
Yes, girl, me too.
Yep. Try to get my gallon of water in, and then just making sure I'm eating healthy. My green vegetables, taking that time, my fruits, all of those good things, eating a healthy breakfast, trying to stay away from some of the sugars, processed foods.
It's so hard.
It really is. It really is. But, I've noticed that, I feel different. My immune system interacts a little bit better. And then also, we're in the midst of allergy season. So I'm taking my Flonase, just doing the regular things that can prevent. But outside of supplement things, those are the biggest things that I'm doing.
Yes. And you're washing your hands, you're doing all the other precautions, and that's amazing. Yeah. So you guys take notes on that. And then let's see, one last question. So they said, are supplies getting directed to where they're most needed?
So when we say that, we have to look, first of all, unfortunately, we can't look at it from a totally USA perspective.
Right.
We have to look at it from state to state to state. So I've been following not only what's going on here in Texas, but also in Illinois. So the governor there, he's done an amazing job in Illinois, really communicating to the people where federal supplies are coming from.
Yeah.
And we're not seeing that, we're not seeing that. There are a lot of governors specifically who are calling directly to the White House, directly to the CDC, and asking for supplies. And it's difficult because they're being told that they have to try to resource these things themselves.
Wow.
How do you do that? And, so it really is going to be a push of supporting our local governments, speaking to your senators, finding out what's going on, even contacting. There have been a lot of hospitals that they are asking, hey, you can bring in your extra masks. If, there have been some tattoo shops that can't tattoo now. So they're like, well, I have masks, I have gloves. Yeah. I can drop it off at my nearest hospital. So this is one of those times too, when we talked about perspective, if we were concerned about the America becoming divided, this is actually an opportunity where we can come together in unity and help somebody. Biggest thing you can do, I don't have any gloves, I don't have any masks. Dr. Gilbert wants you to stay at home.
Yes.
Okay, that's
number one.
The biggest thing you can do. If you can stay at home, just stay at home. Yeah.
Yes. So, for example, on my flight here from California, I made my own mask by hand. I was just sewing that thing. I was like, I was so fearful of the airports. And I wonder if, that's going to change. Our flight's going to get canceled. There's so many unknowns.
There's so many unknowns. And I think, again, what we can do is starting to think about community. So one of the things I really do like to support is small businesses. Women-owned businesses. So a lot of things like our estheticians, our beauticians, our nail salons. One way we can think about supporting them in this, because a lot of them, again, they are self-supported. Go ahead and buy a gift card. You're going to go get your hair done after all this is done.
Right.
Go ahead and make sure they can start putting money in their pocket now. This has nothing to do with health, but just one of those social things that we can try. I went to my esthetician yesterday. She squeezed me in
Me too, girl. I was like, don't you see that?
So that's what we were talking about, buying that gift card, supporting them in different ways, and just figuring out how we can support to keep our communities, our society still moving in little ways.
Okay. And then this is my personal question. What do you think we can learn from other countries?
Yeah. One, I think this is a humbling experience for the United States.
Yes.
You know, yes, we like to think we are the biggest and we are the baddest, sure. But there's opportunities with Italy and with China that maybe we were not paying attention as well. And so I'm hoping from a global medicine perspective from the World Health Organization that we are going to be more inclusive.
Yeah.
I hope too that we have the opportunity to take away the stigma that has been related. This is not the Chinese virus.
Yes.
This is not the Asian virus. It's not some terrorist attack. It's none of those things. But this is the opportunity where we can really consider ourselves a global community.
Yeah.
How can we support each other? So in the event that the next time this happens, hopefully never in our lifetime again, but we can leave the next generation with more information on what to do and how we can work together in this.
Yes, this definitely will bring us all together, all nations. I hope it does
Mm-hmm.
that. So thank you so much for your time. I know you have to get back.
Yeah.
But it's
Thank
been
you
wonderful.
so much. You stay safe out there. And
You
again,
too.
thank you for creating this amazing platform. I'm hoping we can share this to the RD page.
We can.
We can make sure our followers are keeping up too.
Okay, because I've been recording it, so we have this, okay?
Perfect.
Thank you so much, Amanda.
All right. Bye, Robin. Stay safe. Bye.
But I hope you guys enjoyed that. If you have any other questions, you can DM me. You can definitely follow the Doe Show and talk to that page. I just know my following is here, and I want you guys to stay updated. Health is clearly important at this time. So you guys, if you could just follow the pages that I've pinned below, and just thank you so much for watching, and I hope you enjoyed it.